Okay, thank you for inviting me to, as a family carer, give my response to the new carer strategy. It's really good to be here. I'm Mark Austin, and I'm the father of a not so young man now. He's already in his 40s, called Robbie. Robbie has been supported by Islington, well, ever since he was born, really. And we've had all sorts of support through the years. When he was living at home with us, he had a personal budget, and then in the last 10 years he's been living in supported accommodation, supported by Centre 404, but funded by the council. And he also has a part-time job funded by the council. And I just wanted to mention that because I think it's important to recognise what the Carers Strategy is doing is building on a lot of very good practice in the borough already. So you could say, well, why do we need a Carers Strategy? And I think my answer to that is that reading through the strategy, what is so good about it is that it actually goes into a lot of detail about the whole range of needs that carers have. It's a very complicated area, and every carer is different, but we all do have certain needs that we share. And I think it's great that the strategy does indeed detail them with those 6 priority areas. But what's even better about it, I mean, that's the easy bit in a sense, but what's even better about it is that it doesn't just detail the needs, it also details ways of addressing those needs. And I think it comes through really strongly that it's a really multi-agency approach. So it's not just the council, it's the council and the NHS. It's the council, the NHS and all the voluntary organisations that are involved, like Age Concern, Centre 404, MinCap, Healthwatch and so on. And that's great, and I think that's really important. It's obviously, it's a constant theme, it's really important that the agencies work together, not in their own separate silos, which is always a danger. But I would say, I mean, I think that's one of the big challenges for carers, is that it is so complicated, and really getting a grip on what is available is very, very difficult. And so I would welcome what's in the strategy around communication, saying that it's not just an agency like Age Concern, the Carers Hub, it's not just what it provides itself, but also the signposting role that it has to all the other different services. And the same is true for Centre 404. So that's the background. There's elements in the whole strategy that I would very much say that I welcome, which is, one of them is co-production. The emphasis on working with family carers in co-producing services and delivering them as well. And also of course, it's so important when there are so many cuts to council services, making sure the services are delivered as well as they can be with the resources that are available.